Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad wa ala Sayyidina Muhammad sahibi Sayyidina Muhammad kulli dunya wa barik wa sallim wa sallim. Assalamu alaikum. Welcome to the first academic session of the start of your second year BDS, the subject of pharmacology. Now it's very important to understand subject of pharmacology and to make the concept of pharmacology, otherwise it will be very difficult to grasp the subject of pharmacology. So it is requested to please go through carefully and listen carefully and try to understand the concept of pharmacology in next 4 to 5 lectures. First of all, what is pharmacology? Now, pharmacology is a branch of science which deals with pharmacokinetic aspects and pharmacodynamic aspects of the drug. Pharmacokinetic means movement here. In these aspects, these processes, drug moves from one side to another. Absorption. From the site of application, it is entering into the blood after crossing the membrane. So moving. Distribution to the various sites of the body. Metabolism, again going to the metabolic site and then being transformed into its metabolites, and then the excretion through various excretory organs, especially through kidney. So pharmacokinetic aspects. Then the pharmacodynamic, dynamic, action, activity. So drug effects, drug uses, and mechanism of action. How the effects are produced, that is mechanism. So simply we can call pharmacology is a branch of science. We deal with pharmacokinetic and pharmacodynamic aspects of the drugs. Now, first of all, what is a drug? Remember, it is a chemical substance that acts on the biological systems through its chemical or molecular level and then produces changes or alteration in the function of that biological system. So remember, drug is always an active substance. Active means capability to produce the drug effect. So drug is always active. If it is not active, it is not a drug. Then we can call it some by other name. Another important thing is you should remember throughout your life now, every drug has its own peculiar molecular structure. Just like we have specific fingerprints. So due to this peculiar molecular structure, the drug has its specific pharmacology. Now specific pharmacology means specific pharmacokinetic, specific pharmacodynamic. So absorption specific, distribution to the various parts of the body specific, and then metabolism specific, and excretions all are specific to that drug, and that is due to its specific molecular structure. Similarly, specific pharmacodynamic, specific effect, specific usage, and specific molecular mechanism. Then a prodrug. Drug was active, but prodrug is an inactive form of a drug. Usually it is before the drug. In few cases, not always. Usually we are using the substance in the form of drug, But there are some examples. Instead of drug, we are using them in a pro-drug form. So if we are using in the form of pro-drug and we give to the patient, so inside the body they get metabolized and then converted into the active form, that is converted into the drug. For example, levodopa. From our previous knowledge of physiology, we know that levodopa is used in the disease of Parkinsonism. We know in Parkinsonism actually there is specific deficiency of dopamine in the basal ganglia. But at the same time we know that dopamine itself, if given as a drug from outside the body, it cannot cross the blood-brain barrier, so cannot enter into the brain to reach the basal ganglia. So on the other hand, because levodopa can cross the blood-brain barrier and then enter into brain, so in the brain it is metabolized into dopamine, then which is available to reach at the site of basal ganglia to treat the patient of Parkinsonism. Now these are the few examples of prodrug and their active form: levodopa, alpha-methyl-dopa, prednisone, vancomycin, and they are converted after metabolism to their respective active form: dopamine, alpha-methyl norepinephrine, prednisolone, ampicillin. Here, just to recall you, we know tyrosine was converted into dopa into dopamine, and dopamine into noradrenaline, and noradrenaline to adrenaline in the body, as we have studied in biochemistry. So similarly here, when we are giving them as a drug, it is a levo form of dopa. It is converted into dopamine, as we have just seen in the previous drug for the treatment of Parkinson's. It is the alpha-methyl form of dopa. It will be converted in first of all alpha-methyl dopamine and then alpha-methyl norepinephrine. So actually, ultimately, it is converted into alpha-methyl norepinephrine. Levodopa was having used in the treatment of Parkinson's, but this methyl dopa is used in the treatment of high blood pressure, hypertension. Placebo. Remember simple English word. It is an inactive and dummy preparation. So difference between pro-drug and placebo. Pro-drug was inactive but not dummy. Placebo is a dummy preparation. So due to dummy, obviously it has not capability to produce any effect. That is why it is inactive. So just like our dummy mobile being displayed in the mobile shops, these are the dummy preparation of the drugs. Similar to drug, but they are inactive. So, but they are also used deliberately for some non-specific and psychological effects. And these are used for the patient with symptoms of illness. In the clinical side, usually just to satisfy the psychological aspect of the drug at time, we can give the injection of simple distilled water. So, but the patient is having the impression that is he or she is getting some drug, and that patient usually, if it is psychological aspect, it will be getting relief of that problem due to simple injection of distilled water. So placebo. Orphan drugs. Obviously, these are the drugs, active form. But these drugs are used for rare diseases or rare conditions. So that is why they are given the title of orphan drugs. So either treatment or diagnosis or prevention of rare diseases, these orphan drugs are used. Have some diagrammatic explanation of the definition of pharmacology we have already studied. So when any drug or a product is given through any route, just we will go through inshallah different routes of administration through mouth or through injection or anyhow. But if this drug or a product is absorbed, means it enters into the blood and gradually the concentration in the stomach circulation start rising and reach to some specific level. From systemic circulation, then these drug or product is distributed into the body, various parts of the body. These drugs reaching into different tissues will obviously, depending on the tissue, will perform different effects. At the same time, they are eliminated also. Remember, in pharmacology, elimination means to convert the drug which was active into inactive. So again, converting the drug into inactive is known as elimination. This is achieved usually mainly through metabolism, or if even after metabolism few drugs still are active, yet they have not become inactive. So then they are excreted from the body. Excretion is simply removal of the drug from the body. So when it is removed out of the body, so obviously no more available as active form. So in this way, we call elimination occur through both metabolism and excretion. This is collectively known as pharmacokinetic: absorption, distribution, metabolism, and excretion. While when it reaches into site of action, it will produce some effects. These pharmacological effects, if the levels are within the therapeutic means, those levels which are useful for different problems, they will be known as therapeutic effects. But if the levels are more than that, they can be toxic. So pharmacological effects includes all these, and obviously then those effects are used. So these are collectively known as pharmacodynamic, as we have seen. Remember, there are different components under the heading of which we study a drug. So a drug profile. So what is our source, from where we are getting that particular drugs? What are the names given? First of all, their laboratory name, then chemical names, then the brand name, the pharmaceutical firm which was involved in the development of the drug. Then the grouping, classification, especially with the prototype of some drug and then the other members also. Routes of administration, through which routes we are giving the drugs for their usefulness. Then obviously pharmacokinetic aspect we study: absorption, distribution, metabolism, excretion. Then mechanism of action, their usage. Indications means the condition in which the drug is used, that means usage. Obviously with how much dose and which form. Forms mean how we are preparing the drug, for example in the form of tablet or capsule or injection or ointment or eye drops, ear drop, etc., etc. Those are the forms or preparation of the drug. Then the contraindications, the condition in which the drug is not used. It is very important. We must always remember the conditions in which the drug is not given, just like in our daily life. No doubt, important thing is what to do, but at the same time, more important is what not to do. Similarly, here, indications are very important. but at the same time, contraindications are also very important. Then the side effects. Side effects mean those pharmacological effects produced by that particular drug which are not being used in that particular patient but effects are being produced, those will become the side effects. I give the example of some drug here. We have just studied the levodopa, which was converted into dopamine. So actually effects are being produced through dopamine, and whatever the effects of dopamine will be produced will be considered the effects of levodopa, because actually dopamine was converted into due to the presence of levodopa. So anyhow, levodopa use was for Parkinsonism, but when it is present in the peripheral sides, converted into peripheral side, it will produce its effects on CVS and GIT. And those effects obviously are not required. The requirement is to treat the Parkinsonism, which is the problem of the brain. But the effects produced on the CVS and GIT will become the side effects of dopamine, but at the same time, side effects of the levodopa. Drug interaction means drug interactions. When two or more than two drugs are given together, they can affect the effects of each other, can increase or decrease, or can block, etc. I told you routes of administration. It is a common observation, you know. It can be given through inhalation. This is the inhaler, might be present in different homes. Patients suffering from bronchial asthma, etc., or other conditions, they are using these inhaler, or oral capsule form, tablet form, or in children powder form, given through mouth. Then through injection, parenteral. The word is given through injection is parenteral, subcutaneous, intramuscular, intravenous, intraarterial, etc., etc. Or through rectal, through the anal canal in the rectum. Suppositories. Suppositories are name given to those preparations which are given through rectum, rectal suppository. Then the transdermal patches applied on the skin, and through skin the drugs molecules are passing those membranes and entering into the blood and getting absorbed. We can recall some sort of drugs, but anyhow we will give you example of some nitroglycerin transdermal patches or nicotine transdermal patches, or as I've told you, parenteral also, but intravenous through these drips, are topical, means applied on the top of the skin or mucous membrane, etc. Topical routes. So these are the different routes of drug administration. So we can now summarize it. Okay, these are either systemic or non-systemic or topical. Systemics are enteral, enter means related to GIT, parenteral other than GIT, inhalational through lungs, and transdermal through skin. These are some examples. Enteral, oral through mouth, sublingual means under the tongue, rectal means, as I've told you, through rectum. Other than GIT, through syringe, subcutaneous, intramuscular, intravenous. Through lungs, inhaler we have already seen, and general static also. Through skin, I have told you, nitroglycerin, one of the nitrates, few insecticides, and nicotine, etc. And topical means non-systemic, locally. In the eye drops, on the skin, ointment, or gel, etc. Lungs aerosol, no. Remember, if it is for systemic use, we want the drug should be absorbed through lungs and produce some systemic effects, then it is coming under the systemic route. But if we want that the effect should be restricted to the lungs, it will be regional or topical non-systemic. And similarly, anal route topically, some ointment or cream we are applying into the anal canal, some problem like hemorrhoids, etc. And vaginal, some preparation applying to the vagina, some vaginal problem. Selection of route, how we select which route we should adopt. So obviously that depends upon the effect needed to us, whether we need some systemic effects or local effects, because problem or disease may be either systemic or local. Local routes also, obviously we have just seen, are through skin, mucous membrane, like in the mouth, eye, nose, vagina, rectum, we have seen just before. And systemic mean systems of the body, CVS, CNS, problem related to these systems. So accordingly, our selection of drug is in the form of tablet, syrup, injection, if we want to get some systemic effects, or ointment if local. And accordingly, route of administration also changes. Okay, these are explanation of route of administration: sublingual or buccal under the tongue. Here we are giving the drug. The drug is dissolved here in the saliva. Molecules are separated and they are getting absorbed. And through these veins, it is going to the systemic circulation. Orally, through mouth, this is the esophagus and stomach and small intestine and then the large intestine. So when given orally, the drug is absorbed into the portal circulation, and through portal circulation it is going into the liver and then the systemic circulation, like this. Okay, so obviously the amounts will be varying. Okay, how much is absorbed, number one, and after absorption how much it is reaching into the liver and how much is left after metabolism, because liver is the major site of metabolism. So when the drug enter into the liver, obviously metabolism will start. So it will vary from drug to drug depending on its chemical structure. Okay, how much percentage of the drug is metabolized and how much is left. Whatever the left or even metabolized will enter into the systemic circulation. But remember, we will see later on inshallah, the majority of the majority available up to now, after metabolism, they become inactive. We have seen they are eliminated. Now the rectal. We know lower half, if the drug is absorbed from here, we see the molecules are entering directly into systemic circulation, while the upper half will go through the portal circulation into the liver and then systemic circulation. So lower half will not be metabolized, which is going directly into systemic circulation, because in this way liver is not coming or any other metabolic site, while the upper half obviously after being absorbed through portal circulation reaching into liver. So depending on the chemical structure, the percentage of that drug will be metabolized, and the remaining unmetabolized, if left, will reach into systemic circulation. Now some other routes also. Obviously these are the systemic side going into heart, and then heart is sending the drug along the circulation to all the parts of the body. These are some other transdermal, etc. Intramuscular, in this way, the molecules are being absorbed into the vessel of the skeletal muscle and then into systemic circulation. Here also liver is not coming, so no metabolism occurring through this intramuscular route. Similarly, intravenous also. Similarly, transdermal or subcutaneous also. All are reaching directly into systemic circulation because in all the pathway, any other metabolic, including liver, is not coming, and in the very first entrance, no metabolism is occurring through these routes of administration. And then drugs are distributed through systemic circulation to the various parts of the body. Transdermal patch like that. Here the further explanation. Drug diffuses from the transdermal reservoir into subcutaneous tissue and then into the blood and through blood producing systemic effect. Subcutaneous through similar transdermal patch, etc. All these routes are drug molecule going into the systemic circulation. So obviously varying amount. Few molecules may be left there, not getting absorbed, so they stay inside the tissue. So 100% may not be reaching inside. However, intravenously 100% molecules are being entered into the systemic circulation. Inhalation also through aerosol like in bronchial asthma we have seen. So if we want the drug to remain into the lungs, it will be locally. Okay, so very little will go to the systemic circulation because very little will be absorbed, like in bronchial asthma. But there are some conditions in which we want the drug should go to the site. For example, general anesthesia. Here we want the drug should be 100% absorbed here and through systemic circulation to reach to the brain, and the patient should become unconscious due to general anesthesia. Just see absorption through alveoli, single layer only, which the molecule has to cross and enter to the blood. So very easily through lungs, the drugs are absorbed. So after this, we will go through inshallah next time to the next aspect of the pharmacology. Thank you very much.